welcome to this West Midlands School of Clinical Hypnotherapy revision video. In this video we're going to be looking at the basics or the groundwork to a hypnotic induction. So the first thing we need to know is what is the aim of a hypnotic induction, or perhaps even what is a hypnotic induction. The two are intertwined. And a hypnotic induction is the first element of formal hypnosis. There are lots of pre-elements and we're mostly going to discuss those. But the first element of the formal hypnosis procedure that the public, the patient, the client, whatever you want to call them, would recognise, if you like, as hypnosis, is the induction. And usually it's definable by when they close their eyes. Now you may or may not be inducing a deep state of trance as part of your induction. You might be doing something really quick. I mean, the shortest form of induction technically is a thing called simple eye closure, which is just asking them to close their eyes. Obviously you'd have to follow that up with something if you're looking for real hypnosis. Okay, so the aim of the induction though, primarily is to get them to close their eyes, willingly, compliantly, happily, comfortably. So they close their eyes in such a way that they're happy about it. And this is where the groundwork comes in, because if you were doing that simple eye closure I just referred to, just getting someone to walk into the office and go, close your eyes, might work actually, but there's a lot of potential problems with it. So what we're going to discuss here is dealing with those potential problems in advance, or what you should be thinking about to deal with those problems. So the aim of the induction, close their eyes, but pre-induction work, preparation. So there's a few things to consider here. First one I've noted is comfort, physical comfort of the patient. So what we're talking about here is, have they been to the toilet? And you really should get this one out of the way at the earliest opportunity before you get anywhere near the hypnosis. It would be normal to invite somebody the minute they step through the sort of consulting room door to say, see if they need the toilet. Because the one thing you don't want to do is to mention, do they need the toilet, just before you go into hypnosis. Because a lot of people will just politely, casually go, no, 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 no. And then they're going to be going, do I? Was I right on that? Especially if you're working, of course, with people who have bladder and bowel disorders, whether that's actually what you're working with them for, or whether it's a comorbidity, whatever it may be. So physical comfort in terms of have they been to the toilet, but also is the room comfortable? Is the space comfortable? A tight, cramped, dull space with very little natural lighting can be very intimidating. You know, it's like a little prison cell. So daylight can be preferable, a large airy room can be preferable. It's less intimidating. Temperature is also an important issue. If it's too cold, people won't be able to relax very well. They might be able to go into a traditional form of hypnosis, a sleep-based induction. But if you're doing relaxation work, which is of course what we tend to do more of in therapy, you want it to be warm enough that they can actually relax. Or if you're in a hot country, cool enough that they can relax. Because if they're just sitting there sweating away, that's probably not going to help at all. I generally recommend you're thinking in terms of about 21 to 22 degrees would be the temperature I would traditionally look to work at. It's warm enough that they can relax, whilst at the same time being cool enough that they're not going to get too hot. It's worth remembering as well, of course, that people, when they're sitting still and calm in the way they often do in a hypnotic session, they're getting cooler all the time. So you as the therapist might be still quite warm, but they're going to be a degree or two cooler than you. So just be aware of that. Okay. Understanding what hypnosis is, what to expect. Now, there may be a balance to be struck here between going into a lot of detail, which will be long and technical and dull and boring and ineffective, and having a simple, clear explanation. Usually we talk about getting rid of what you might call the myths and misconceptions of hypnosis. Although evidence is suggesting that they have been exaggerated, most people don't have them. It is usually, however, worth going over that you can't make them do anything they don't want to do. You're there to help guide them towards something that they want to achieve. Okay, so making sure they have a basic understanding of hypnosis. They'll probably be able to hear things that are going on around, but they won't necessarily engage with them. It's like sleep, but it's not the same as sleep, and that everybody has a different depth of hypnosis is worth bringing to their attention. Okay. Consent. As a therapist, it is important to get a person's consent. Now, there is an argument that there is implied consent just by the very fact that they're coming to you for a hypnosis session and they know that you're a hypnotherapist. But it's usually worth just double checking, are you ready to go into hypnosis? Just to formalise that process of they have agreed to this. This is their decision and thus we're going forward. Okay. So, factor number 3, stabilisation. Perhaps not what you might think. Psychological stabilisation, which is what a lot of people might jump to, is an important factor, and we'll talk about that later on. But what we're talking about here is physical stabilisation, i.e., is the platform that you're doing hypnosis on, be it a chair, be it a bed, sofa, beds I generally don't recommend to be fair, is it strong, is it solid? Now, if you're doing weight work, you may well have somebody who's 25, 30 stone coming to you for that kind of work. And if they're on a little flimsy chair, they're going to feel unhappy. They're not going to be able to relax properly. So there has to be stabilisation in the platform. And another great tip for stabilisation is just get them to place their feet flat on the floor. Nice, solid foundation that produces. So feet flat on the floor and a good, solid, well-built chair. Preferably very comfortable. Okay. And 4th on the list is cooperative mind. We want them to have a cooperative mind, of course we do. We want them to be going with the process. And there are many subtle barriers, which we'll discuss later on in more detail, towards that. But the basics are, by getting their consent, they are cooperating. The other thing we might do, for example, I'll mention here is a yes set. I won't go into detail that because we're going to cover it in another video. But there are many little ways in which you can encourage the cooperative mind, reminding them this is something they have chosen to do. This is their will, their goal, their achievement. And just little things like that can make a difference. Now we're going to talk about most of these factors in a lot more detail as we go on. This is just a general introduction, but hopefully it's been helpful. So, thank you very much.